I'm Elizabth Barrett-Connor. I've been at the University of California, San Diego on the faculty since 1942. I like to say I was 35 then, but not true. At any rate, I have been working mainly on why women live longer than men, and done a lot of work on depression. And depression is more common in women, and they have different kinds of depression. So today I was talking a little bit about women and depression, and I was pointing out that the studies that we have are really very poor. There are not enough good studies. But one thing we do know is if you have diabetes and depression, you're more likely to die, all-cause mortality, and it's very striking. If you have diabetes alone, you are more likely to die, but nothing like when you have the combination. So the worst one is diabetes and depression. The second one is diabetes, and the third one is just depression, and neither is the best. So it's not an unimportant disease. It's really an important disease. So I was trying to say how unsatisfactory the data are, and I used a couple of examples. One is a study that looked at, and is quoted all the time, all these studies that show that this is a really common observation. So altogether, there's 25 studies, most of them very small, like 10, 12 people. Most of them only look in one direction, so they have a bunch of depressed people that they went to see whether they got more diabetes, and they have a bunch of diabetic people, and they look to see if they got more depression. But only one of those studies had both directions. That's what you need. So when you read the review, you would think that they were talking about half of the studies show this, and the other half of the studies show that, but they are separate studies, and they're really small studies. So I was saying that it's very important that we pay attention to that. The other main point I made is that women have a lot of, quote, mild depression, not the kind where they really do need pills and they're psychotic and probably should be seen by a psychiatrist. And those women do extremely well with cognitive behavioral therapy. That's a licensed person who I think has 2 years of training, and she is licensed not to prescribe pills, but to refer patients if they need pills. But she specializes, and they're not all she's, but a lot of the ones I know are women, they specialize on taking care of the patients when they need them. So a woman may be depressed because she's now got 3 kids and the husband isn't acting like she's attractive, or he's not helping her to cook, or he's whatever men do in their midlife, which they repeatedly do, it seems like. So she's unhappy and she needs to talk to somebody. And so she talks to a CBT, a cognitive behavioral therapy, and that person will be there for her. If she's in Europe, she'll have a number. She'll call you back night or day. And you know that you have this kind of instant need, and some of these women are very needy because of their life circumstances, and they're often impoverished. They don't have a job they respect because they got married young and they never got an education to get one. They're not happy with themselves anyway. So those women, the cognitive behavioral therapists are perfect for that, and there is no data that medication is good for them. It does not work. So we should not be giving people who can be managed that way with medications. And actually there are several studies that show that people are more likely to die if they take sleeping pills, which is a common thing for women to take who are depressed at night, can't sleep. And sleeping pills carry a risk of mortality. So the bottom line is, if you have mild depression, you probably can do very well with a good cognitive behavioral therapist. If you need a psychiatrist, you should see one. But then I think you need to be aware of the fact that there's a very high relapse rate for the ones who need a psychiatrist, and it is higher if you have diabetes than if you don't. So that diabetics are a really difficult group. If they have severe depression, and some of them do, then they're really hard to manage. They tend to relapse. Many people without diabetes also tend to relapse, but relapses are more common in diabetics. So it's a complicated story. That's a complicated review of a short talk, but that's what the points I was trying to make.